747, we're joined now by Laura Wershler. Laura is the Executive Director of the Sexual Health Access Alberta. And Laura, that's the charity that's going to be folding, am I right?
Yes, that's right, at the end of July.
Why is that?
Well, our board made a decision that, taking into consideration that we've accomplished many of the goals that we were founded upon, and looking for the most efficient and productive way to sustain the great programs we're currently doing, but taking into account also the challenging nonprofit funding environment, decided that this was the time to pursue a strategic closing that ensured that we leave a legacy.
Okay, you're of the opinion there's too many small charities, and I guess it's getting tougher for them every day, isn't it?
No, I don't hold that opinion.
Oh.
That may be misinterpreted. I think that there are many small charities and maybe large ones. There's been stories in the Globe and Mail recently about the challenges to larger organizations as well, who are having to look at new ways of sustaining themselves and their programs. But I do suggest that it may be an opportunity for some organizations who are struggling to re-envision their sustainability model and determine whether or not this might be a course of action that would be suitable for their charities.
So what would be the best way to do it? Maybe band together and operate as a group? Would that be a better way, do you think?
Well, I think that there's always an opportunity when you're working in a field where there are other organizations doing similar work to possibly merge. I think mergers are certainly something that charities have pursued over the years. In our case, it seemed to make more sense to pass on our core programs to colleagues working in the area and to close our organization as a formal entity.
Okay. You're also advising people on the situation with their charities, are you not?
Well, in part, we're working with the Centre for Non-Profit Management, CentrePoint here in Calgary, and they've asked us to contribute to a workshop for other organizations who might consider this path, to learn from our experience, our decision-making process, and the process that we followed, that we are currently following towards closure.
Okay, now, when you shut this down, is it because the information and the services you provided is already being provided, or was it because you just couldn't make enough money to stay afloat?
Well, I think we take into account all things. But when we started our organization back in the mid-'70s, there was very little access to sexual and reproductive health services. Sex education in the schools was just beginning. And when we look at where we are today, we've got fantastic network of sexual and reproductive health care providers throughout the province. That consists of not-for-profit organizations, some private medical clinics, as well as public health clinics. And comprehensive sexual health education is mandated in the province of Alberta.
Okay.
And in fact, Alberta Health manages and supports a website called teachingsexualhealth.ca so that teachers wherever they are in the province can download lesson plans that support the curriculum and present these lessons in the classroom.
So, and I wish we could say this about all charities, but basically mission accomplished. You've done what you set out to do, and now it's time to close her down and move on to other things, right?
Yes, there's always more to be done, but we feel that certainly in our field of service, there's fantastic work being done in the province.
Okay. Well, thanks for talking to us, Laura.
You're very welcome.
Have a good day.
Bye-bye.
Laura Wershler, Executive Director of the former Sexual Health Access Alberta charity, which is now being covered in other areas, and she feels that a lot of smaller charities are going to have to maybe look at their fundraising, and we know it's a big problem for a lot of charities, a lot of challenges these days.